Hello, everyone, and welcome to today's webinar on Impact and Learnings from Relationship-Centered Communication Program at a community-based safety net institution. Thank you for joining us. This webinar is hosted by the Academy of Communication and Healthcare. My name is Rachel Porch, and I'm the project coordinator here at the Academy. ACH is a nationally based nonprofit organization, and this webinar is part of a special series from ACH where communication training program leads from institutions share their journey in implementing a skills training program at their home institutions. If you are not a member of ACH and would like to benefit from our recorded webinars, online membership community, as well as many other valuable benefits, we'd like to invite you to join our organization. Feel free to visit our website for more information at achonline.org. Before we get started, a quick housekeeping note. You're welcome to use the chat feature, which you can find at the bottom of your screen. We'll be holding all questions for the end, but if any come up throughout that you want to save, be sure to type them in there, and we will address questions at the end, time permitting. Moving forward, I'm very pleased to begin my handover here to welcome our guests from San Mateo Medical Center, Dr. Alpa Sanghavi and Sumita Kaura. Dr. Sanghavi is Chief Quality and Experience Officer at San Mateo Medical Center and is a board-certified internist and palliative care physician. Her clinical practice is focused on hospital medicine. And Dr. Kaura is the chair of the Department of Primary Care at San Mateo Medical Center. And she also works as a staff physician in the Innovative Care Clinic and pediatric clinics there. She serves underserved populations of San Mateo County. So I will now pass the presentation to you both. Welcome, and we're so glad to have you.
Thank you very much. So we'll jump right in. This is a little bit about us. We are located right between Stanford and UCSF in San Mateo County. We are a county system of healthcare, and our mission is that we partner with our patients to provide excellent care with compassion and respect. Here's a little bit more about us. So as you can see from this slide, we have a very small inpatient footprint. We are only about 100 acute beds, and that includes acute med-surg as well as psychiatry. We have a small emergency room, even though it is the second busiest emergency room in the peninsula. Really small ICU, but a very large outpatient footprint. We have almost 250,000 clinic visits every year. And compared to that, our inpatient days are only about 13,000. We have a total of about 475 medical staff. A little bit more about our patient population. Just want to emphasize here that we have more Spanish-speaking patients than English speakers, and these are self-identified as primary language being Spanish or preferred language being Spanish. So we have our challenges. Also, we're not a teaching hospital, so whatever we say here is, I would like you all to kind of see it in that perspective. So safety net hospital, community hospital, majority Spanish speaking patients, a lot of other languages spoken, and non-teaching hospital. So starting our journey, this is where we were in 2015. This is the kind of feedback we were getting from our patients in our patient experience surveys. Things like our providers were not being perceived as very attentive. Patients felt like we were not listening to them. A lot of times we heard that the patients felt rushed, and we didn't have time to answer their questions. We had by then, so I just want to bring up a little bit of our strategic plan. So we created a position, this was a new position, of Chief Quality and Patient Experience Officer in 2013. And by creating this position, the CEO at that time really wanted to make it very clear to the entire organization and to the community that patient experience was as important as quality and all other aspects of patient care. And also, they really wanted to have a physician in this role. And so it was pretty clear, it was made very clear to everybody that this is going to be a very high priority for our organization. And once I started in this role, we did many different things in terms of improving communication across the organization. Most of you have heard of AIDED, which is basically just service standard, or just the communication basics. We rolled that out to the entire organization, and then we branded AIDED into what we call We Care. It's very similar to some other organization. They call it CI Care or I Care. It's just our branding of AIDED. Again, it's just basic service standard. We had done some health coach training. We had kind of tried a motivational interview training. And from all of this, it was obvious that providers really wanted something which was tailored just for the providers. Everybody agreed that some kind of detailed communication training was needed, or we were ready for that. But what that would be was not really clear at that time. So it took me almost 2 years, I want to say at least 1.5 years, to really evaluate different programs that were out there, also to go through the RFP process, and also set out a budget for something like this for provider training. So finally, we had everything in place. As I said before, we had great buy-in from the executive team because the position was created with something like this in mind, in addition to really emphasizing patient experience across the organization. So once all the planning and all was done, then we were kind of ready. So we, after the RFP process, ACH was chosen as the organization that we were going to partner with. And we really liked the concept of Train the Trainer program, where we will be training our own trainers so that we can then continue to have this program for as long as we are in existence. So I want to just talk a little bit about our first training. A lot of buzz was created about the training in the beginning. We also were very strategic as to who would attend the first training. It was by invitation only. And we had two excellent trainers, Calvin Chow and Denise Davis from ACH, who came and delivered the very first training. We picked about 20 providers. And this was very thoughtful decision. We made sure that we brought in all the leaders from different departments. Medical directors of all our 7 satellite clinics were invited to attend the training. We made sure we got leaders from emergency department, psychiatry, psychology, and our specialist to attend. Now, let me just tell you a little bit about our specialist. We just to give you an idea of how small we are, when we talk about Department of Cardiology, it consists of 3 cardiologists. We have 1 rheumatologist, and we have 1 pulmonologist. So we just wanted to make sure that we had representation from at least one medical specialist and 1 surgical specialist attending our training. These were going to be our cheerleaders who would be spreading the word about the training and also encouraging their own colleagues to attend the training. So this was very, very important first step for us. The first training went very well, and we started seeing the pull from different departments and different providers, really telling us how important it would be to spread this training to the rest of the organization. Next step was about choosing the right trainers. Again, we were very thoughtful. We made sure that we picked people who were well respected, who really were trendsetters, people who were not afraid of change and were going to be spreading the word and would be really encouraging people to attend. One of the examples was our urologist. He wanted to do something like this because he was at this stage in his career where he was ready for something different. And he was so well respected in the organization that some of our ER physicians said that if Chris is teaching something, I will attend just because Chris is teaching it. So these were the trainers that we had to pick. One of our pediatrician was the chief of staff at that time, and we thought it was very important that if the chief of staff herself is a trainer, that would have a much bigger impact. Sumita was the medical director of one of our biggest clinics, and she was going to be one of our trainers. So we, again, were very thoughtful and strategic about choosing our trainers. We also needed to make sure that everybody we chose had a genuine interest in this work and also were going to be able to commit the time required for the trainer's training. As some of you know, it's a full, it's almost a 64-hour training for the trainers. So it was a huge time commitment. Sumita will carry on from here.
Yeah. So once we had our team together of trainers, we had to start thinking about how do we want to roll out our workshops. And was it with anything that we need to do that is amongst the whole medical center, promotion was key. So promoting it and where, we used flyers, we talked about it at the department meetings. It became part of our CME curriculum, which I'll talk about a little bit later. So that was another avenue of promoting our workshops. Then the registration process, which we did end up delegating to our CME office so that they could keep track of registrations. We really wanted to promote this concept and culture shift of really giving a retreat, in a sense, for the providers, a time for them to step away from their clinical duties and come together to enrich their communication. So ambiance was a big part of that, and setting up a room where it didn't look so much like a clinical setting was key. And of course, nourishing ourselves. So with food, making sure that that was something that they didn't have to worry about. We provided lunch. And then CME, free CME is always something all of us are looking for. And so that was another perk for us to promote the communication workshop. And we were lucky that our CME office was able to apply and has been taking care of all of the CME portion of the communication workshops. What I'll get into next is a little bit about success measures, which I know in this day and age, all of us are looking at data and trying to see if the improvements that we make, if they have any success at the end. And so Press Ganey, as you can see, our data here ends in July of 2017, and that's because we went with a different program of measurement we're still gathering data from that new program that we have here. But you can see from April of 2015 to January an upward trend, mean score of 90. And then we wanted to take a deeper dive into that part of our upward trend, specifically regarding communication scores. So as you can see, there also was a bump in the positive direction of communication scores specifically for the providers, which we think was directly resulted from the trainings that were offered. And then finally, once we were looking at what the patient's perspective was, we also wanted to get a sense of the providers themselves. We asked two key questions in terms of if they would recommend SMMC or San Mateo Medical Center as a place to work, and two, if they would recommend their friends and family to come to SMMC to get their care. And as you can see, the green represents that positive trend from 2015 to 2017. What I wanted to say also is that although our emphasis many times is the data and the numbers, that many of the successes of this program are also the qualitative things that we hear. And so I wanted to share one thing with you, which was a quote that a medical director heard from one of the providers that she supervises, and she sent that over to ULPA. And I just think that's really key to hear that, because this is the work we do. I hear you. I hear that you've had so much pain for so long and no one has been listening to you. I wish I could undo your years of pain and frustration, but I can't. What I can do is promise that right here, right now, I'm listening, and I will keep listening until we figure this out together, okay? And so that quote is just one part of that medical director, when she wrote to ALPA, said that this is something I overheard and this is one big success of this program. And I think that's really important to take back also from the success of where we are with our communication workshops. With every success, there are still also challenges that we have, and I think that would be good to go and discuss with you next.
Right. So we really deliberated a lot on whether to make the training mandatory versus voluntary. And then we went back to the principle of this training itself, which is it's a very learner-centric training. And we said, why don't we also go down the learner-centric path and make it voluntary? So it was a very thoughtful decision, again, to say that we're going to encourage people to attend, but we're not going to make it mandatory, because if people are not ready for it, they're just not going to have the same effect as they would be when they really come seeking us out. So the training was kept voluntary, and it still is voluntary. I'll handle the contract versus employed and primary care versus specialists together. So in our organization, all our primary care providers are employed, and all of our specialists, including hospitalists and the ER providers, are contracted. And we had great success with primary care providers because they were interested. All of their supervisors had done the training and were really speaking very highly about the training. Also, once the supervisors were bought in, it was a lot easier because they just had to then block the schedule for the primary care providers so that they could come and show up for the training rather than showing up at the clinic to see the patients. So we had a great support structure in place, and the program became really, really successful with primary care department. I wish I could say the same thing about specialists. We've had some success now with emergency room, and Sumita will touch base a little bit more on it also. But once we modified the training to meet the needs of our emergency room physicians, they've been sending 2 to 3 providers pretty much every time we conduct a training. But with specialists, we are still facing a lot of challenges. We still haven't been able to engage any of our general surgeons to attend the training, but both of our plastic surgeons did. Our neurosurgeon attended the training and spoke very highly of it. So it's still work in progress, and we continue to modify our training to meet the needs and to engage our other specialists.
And so thanks, Alpa. I think that is a good point. And so along with the challenges, I think it's also important to mention what we did to try to overcome some of those. And so one of the things that Alpa was alluding to is that in order to try to see if we could engage our specialists, we did try a different format of a shortened day. So instead of the 8-hour training, we tried a 5.5-hour training. And that's when we started pulling in more of the emergency room. Once after the first year, though, we did notice that the workshops were not filling as much, and so we did change the frequency that we were offering them to be more like once a quarter, which has helped. But then again, once we were overcoming that challenge, then the new challenge arose of keeping our trainers engaged. So if you're only doing one training a quarter, not every trainer is going to get a chance to train more frequently, and they're maybe only hosting a workshop once or twice a year. Is that enough to keep their skills and to keep them engaged is our next challenge. We also lost trainers after the first year, just to 2 or 3 people left our system, and 3 of those trainers were in other departments other than, no, one of them was in primary care, but 2 of them, one of them was our palliative care provider and the other one was our psychologist. And the other challenge that we are, I think, facing now at this level after 2 years is sustaining the momentum of the learner. So what we've heard a lot from those that we have trained is, after the first couple of months, I'm not really sure what skill I need to work on or how I need to address or continue to improve my communication. And I think that's where we come into our next phase where we are now, which is how to sustain and support the program that we have started. And so one way we've thought about trying to keep the momentum of our learners is to, one, do some sort of needs assessment. And so we did that at our brief departmental discussions. So going into the departments and really asking what would be helpful to you. And we had success with this with the primary care department, which makes sense because most of them had attended the workshops already. So just asking them, what format would it be preferable to you to have further discussions? What topics are you challenged with? And what can we make? How can we make ourselves more useful to you? And so this led to a couple of things. One is mini sessions, and so we had a few mini sessions where we went in and actually showed one specific skill set in a smaller setting and just talked about how others would have responded. We also started focusing on focused topics and CME talks. So for example, this past October, we had invited an ACH faculty member, Dr. Calvin Chow, to come in and speak about communication and conflict, and focusing a little bit about controlled medication prescribing, which was really what one of the providers really wanted to hear about, given the new changes with our prescribing in October. So that was really well received. We also started offering consultative support and making our coaches available via phone, via email, and offering that support to our providers. And then coaching by an observer. So this was also well received, but has not caught on quite yet. But as we mentioned, Dr. Janet Chakind, who is our pediatrician here, who was former chief of staff last year, was in her supervisory role able to then coach one of her providers who was struggling with a lot of press skinny comments, and really working with him on his communication. And he found great benefit that he attended the workshop again just about 6 to 8 months ago. And finally, I think with those parts of sustaining also comes with partnering with administration. One of the reasons why our CME dinner last month was so successful is because we were able to start partnering with administration, including our chief medical officer, our director of ambulatory care, and our primary care medical director, to really support providers being able to attend by supporting their schedules being shifted so that they could leave for the CME dinner. So I think that continued partnership is really key to our sustaining ourselves. And with that, I think it's important to start thinking about how do we move forward and what is our future direction.
I also want to bring up one more point here, is that in terms of partnership, as a result of this training, Sumita decided to get into the facilitator and training program, and that has been so wonderful, as now she's also been leading a lot of this work. And so now I have a partner with Sumita to just lead this work in terms of our communication program. Future directions. So we continue to engage administration in making sure that this program is supported. That you want to?
Yeah, and so thanks for that flag, Alba. Learner-centric coaching, as we spoke about, just really trying to find ways to help the skills of our learners. And so we do a follow-up email and then trying to engage them again with trying to think of other opportunities for them to help them with their coaching. And then as we continue to move forward, really keeping an eye out for either people who seem, other learners who may be engaged in this work, have a genuine interest, to start considering them as being new trainers, and if we want to really help facilitate that. And then finally, I think once we've trained most of the providers, since we always are a smaller institution and not a teaching hospital where there's going to be ongoing turnover every few years, is really looking at the other allied health professionals that we can help train. And so I know, Olpa, you had mentioned at one point, I think the dentist had reached out to you.
Yeah, exactly. So dentists would like to participate in this training, and we are thinking that as we move towards team-based care, can we cater this training for the whole team in primary care department? So these are the future things that we're thinking about. So it looks like our timing is coming to an end. So we'll open this up for any questions.
Thank you both so much. We will give the participants here a minute to cultivate any questions. And again, those on the line, you're welcome to type in your questions through the chat box. You can locate the chat box at the bottom of your screen. There should be an icon called chat that you can open.
Rachel, I'm not able to see any chat right now, but
it's might be at the top of your screen, Alpa, since your screen share.
Yep.
So I see that there's a question from Katie, I think that we all can see. Katie Elgas, who states that you mentioned that the location mattered. I'm assuming, Katie, you mean for the location of the workshops. And so, yes, we initially did the first couple of workshops in a classroom setting. And once in a while, we do end up being there just because of real estate being of high need here. But we've had quite a few sessions down in what we call our garden room, which is an area in the lower level, but it's surrounded a little, it doesn't look as much like a classroom. It's surrounded by a lot of nice little gardens, and all of our evaluations from those ones have really reflected that people have enjoyed that space. So I think it really gives that ambiance a different kind of flavor for the workshop.
Yeah, and the garden room is a place where we usually conduct yoga classes for our staff. So it has that feel to it, and it has a beautiful patio where people can walk out in the lunchtime and have lunch there and socialize. So that has really made a big difference when we conduct training in the garden room. Thank you again, Katie. What time of the day did you run the 5.5-hour course for the specialists? So basically we started, it went from 12:30 to 5:30. So instead of people having to take a full day off from work, they only had to take half day off from work. But you're right, practice productivity is definitely a concern, and that has been one of the reasons why we haven't been able to attract as many surgical specialists to our training as we were able to with the primary care providers. I think one of the arguments to make for the taking the time off is you can see the results, right? Not only are our patient experience scores improved, but even our provider engagement scores have gone up. So that has really helped in just really talking to the leadership that this is time worth investing into.
And with that, we will go ahead and conclude our webinar for today. Thank you so much, Sumita and Alpa, for leading an informative webinar, and thank you to everybody who joined and engaged. Hope you have a wonderful day.
Thank you, Rachel.
Thank you, everyone.